Hello and welcome. It's 8 a.m. by the clock. It's time for the Breakfast Club. I'm Sonal Mehrotra here in Mumbai, and we've got lots lined up on the program, as Toya will just tell you.
Right, I'm Toya Singh joining you live from New Delhi. We're going to be talking a little bit about medications today. What you should take, what you shouldn't take, what you should definitely stay away from, and what you don't need to be alarmed about. We'll take a deeper look. Let's first take a look at all of the headlines.
Centre bans over 150 combination drugs. Crackdown on popular cocktail drugs have kicked in yet again. Several painkillers, antibiotic combinations have been banned as they pose a risk to human beings. Next under review are multivitamins. What should your approach to combination drugs be? What should you stay away from? We tell you on the program.
And then we take you to an ingenious solution. It's like plastic, it's not plastic. These are bags that decompose in 180 days, an innovative solution to plastic pollution. Bags that are actually made from corn waste. Who made them? How did he make them? And what was the process of actually bringing them to the ground? Shops, cities across the country. We'll take a deeper dive.
Amid massive success of 3-2, dark cloud loom over its success. The credit war erupts over the entire movie. Who deserves most praise for this 3-2 success? Full details on the program.
And then we bring you a motorcycle review, BSA Gold Star 650 motorcycles. And what we're going to be looking at here is, can this roadster take on the Royal Enfield? Is this finally the bicycle to give challenge to the big daddy of bicycles? Overdrive is going to be bringing you the final verdict right here on the show.
Also on the program, the best of the highlights coming in from Janmashtami. The Janam has happened. It's time for Dahi Handi celebrations across the country.
Let's dive into our big story of the day today. Are you someone who reaches for a pill to tackle migraines, even if you are having a skin reaction of some kind, acne popping up in parts of your face? While popping a pill can sometimes seem like the straightforward solution, there are important risks, possible harms associated with this approach. Today on the show, we want to focus on a topic that affects all of us: combination medication and their potential side effects.
So what's really happened on this story? The government's crackdown on fixed dose combinations. Earlier this week, Centre has banned over 150 widely sold fixed dose combination drugs, or FDCs as they are called by the professionals there, with immediate effect, citing concerns about their irrational and potential risk to our health, and also safer alternatives being made available over there. The government's decision to ban the FDCs is driven by concerns about safety, efficacy, and the reasons really go into things like lack of efficacy. Some of the combinations are found to be ineffective and are providing benefits that were initially claimed but not anymore. There are safety concerns as well. There have been reports of adverse effects associated with these drugs, raising concerns, and then there is regulatory and non-compliance. Some of these drugs simply do not meet the required standards.
Right, the standards that have been set by health authorities. But among the banned drugs are several combinations of enzymes used for the treatment of gastrointestinal problems, combinations of anti-allergic medications that you can see, combinations that are used for the treatment of skin conditions, combinations of anti-allergic medications such as levocetrazine with nasal decongestant syrups that will break down mucus, and paracetamol. So these are all some of the common names that you'll hear, some of the common enzymes that are inside them. The list also includes combinations of antibiotics with acne cream or with iodine solution. So it's really a vast range that has just come out in the newest declaration. Now, the combination of supplements include menthol, aloe vera with vitamin E in the form of medicated soaps. As we said earlier, truly a vast gamut.
Yeah, but if you're still confused about what exactly is a combination drug, let's tell you some basics here. A fixed dose combinations are medicines that have 2 or more active ingredients in a single pill, capsule or a shot. such combination medicines with help patients illnesses like TB, diabetes. That's how they were initially, sort of conceived. And that essentially means that you take fewer pills for a diverse issues that you might have, but they also end up delivering ingredients to patients that they may or may not really need. And it's not the first time these drugs have actually been banned. We've seen these bans come in last year as well. In fact, some more expected to come in the coming days as well. But what should you really be watching out for? Because remember, most of these combination drugs are easily available over the counter. Some very popular names are a regular go-to for us in our households as well. So we thought we'll speak with experts on this one. Dr. M. Wali, he's a Padma Shri awardee and internal medicine specialist, is with us on the program. Let's go in straight to him. Dr. Wali, just sort of first question really over here is, if you could describe to our viewers what exactly is a combination drug, and how do you tell if the one that you're picking up over the counter or one you've been loyal to for several years or really gets you going in no minutes is actually a combination one and could harm you?
Well, these are called fixed dose combinations. When we were a child, even when you were not born, there used to be a very famous tablet called APC, aspirin, paracetamol and caffeine. And this was sold in tons. And the cost was just 2 to 3 paisa. When I as a child used to go to chemist shop, I used to bring this for fever. And this was remedy for everything. Fever, joint pain, headache, body ache. So these combinations were very famous, and they were marketed. Still, such a combination is coming like Ceridon. This is a very famous brand marketed since decades. Now, some research has proved that some combinations which are recent, they interact, and this is a fact. So more are the combination drugs, the more are likelihood, I say likelihood, it doesn't happen actually, we can't see what is happening to the drugs going inside the body, the more is likelihood of cross reaction. These are called interactions. So this phenomena is called drug interaction. So basically we will talk these two terms, drug combinations and drug interaction. So liver is the organ in the body where biotransformation takes place. Now the third term jumps in. So these are the three basic things on which the Ministry of Health has decided to ban or to stop marketing. Ban is not the right word. We should call it stop marketing these combinations.
Doctor, tell us though, thank you for explaining or rather walking us through that, but tell us, if you're a consumer and at some point in your life you've been prescribed that medication, say it's, you've just gone to the doctor a few days ago and it's in that list, is there cause to be worried, especially if you've already taken them?
Not at all. Not at all. It is the same body which has banned these drugs, has permitted these medicines to come in the market. But in the better patient interest and in the better patient safety, this is the step which they have taken, which should be welcomed. In past also, about 20 years back, the same combinations were banned, and I am amazed to see they are still being marketed. So there is something in between which has happened, which I don't know. But the likelihood of interaction of the drugs is to be avoided. So it's a safety measure and we all should appreciate that.
All right, so there's no immediate concern if you've consumed these drugs, but clearly one should be cautious, since from what you're saying, there seems to be a repeated attempt by the government to sort of get them off the market, right? And the order sort of goes into details of saying the manufacturer, sale, anything of this or propagation of these drugs has to stop now. And like I said, Dr. Wali, if you could sort of lay more emphasis on why there has been a need and what exactly are these drugs doing to our body, that successively from 2016 onwards, we've seen several bans come in.
as we see previously they were 344, now they are 156. That means some of them have re-emerged with a different garb, with a different trade name. So this is probably something which is from the government's angle and from the safety angle is very important, but doesn't make any difference to the patients, because now we are prescribing more generic drugs. So there is no need to go by the fancy trade names and prescribing these fixed dose combinations.
Doctor, just tell us, let's almost play devil's advocate for a second. Should all combination drugs be stayed away from? Is that not practical?
Practically, a patient of cardiac disease is eating 10 or 12 medicines. So in the stomach, they become drug combination. So it is very difficult to say what happens when 4 tablets together go in the stomach or 5 tablets together go in the stomach. Very difficult to say what's happening. So what I have told in first answer is biotransformation. It is the duty of the liver to separate these drugs and to biotransform these drugs. Like I'm giving you a very practical example. Acetaminophen is the converted substance of very commonly taken paracetamol. Paracetamol does not act in the body as paracetamol. It is converted, biotransformed into acetaminophen. So there is hardly one preparation in India which contains acetaminophen. All contain paracetamol with different names, 1,000 names you can say. So it is the duty of the liver to assist the body not to get these drugs mixed up in the body, to separately channelize them, biotransform them and send either to the intestine or to the kidney or liver itself. They can be excreted or sent out.
Right. And it is perhaps the liver that gets damaged the most every time you go for an over excessive use of these combination drugs. But what I'm taking away from what you're saying, Dr. Wali, is that according to you, it's not an immediate danger, but there has to be a rationale behind why the government is successfully or, just been at it. What would you like people to take away from this? It's clearly an order not applied on people who are consuming it, but on doctors, on people who are selling it as well. So what would be, how should we read this?
Very simple answer. Don't buy over the counter. Don't make your chemist your doctor, number one. Number two, it is our duty to prescribe the safe drugs, which we are stood by round the clock for every patient always. We will see the patient's safety. No doctor would prescribe damaging drug to the patient. Even if a drug reacts in the body, that is not studied in live human beings. That is an idiosyncrasy or allergy in the particular body. So everything which is available in the market is safe, which is available today is safe. After the ban would be safe and always will be safe. So NTW, not to worry.
Okay, but doctor, I know we're going to have audience members who are still sitting there and asking, and I get why they're asking this question. Why were these drugs removed if they were safe, as you say? How would you answer that?
They can be unsafe in combination. You see, we metabolize these drugs. Suppose somebody does not metabolize in appropriate quantity from a combination, then one drug will overpower the other, and that is what we say adverse reaction. So because of that, it is very simple. Ministry has done its duty for the safety of patients, and we are all duty bound to obey the ministry's orders.
All right, Dr. Wali, we'll leave it there for the moment. Thank you so much. It seems like the drugs and these salts individually are okay, but when put together are damaging your body. And a lot of times we don't have enough evidence on what exactly that combination of drugs is really doing to you, to your liver largely, like the doctor also explained. So really goes on to remains to be seen what really will come out of this ban, since we've seen so many of them. But